Okay, going back. So, teka sandali, yung ating slide. So, going forward sa vital signs, nasa body temperature tayo. Okay, so let's continue sa body temperature. When I say a fever is indicated when body's temperature rises about 1 degree or more over the normal temperature of 98.6. So
Miss Anne,
Fahrenheit.
wala pang slide.
Ah, wala. Sorry. Naku, nagsasalita na ako, my dear. Sandali po.
Okay lang po.
Kaon ako eh. Bakit pa? Alam ko siya.
Okay, so we're here. The slide is on.
Yes, ma'am.
Okay, so we're here in the body temperature.
Ma'am, pa-expand po ng konti.
Oo, sandali po. Okay.
Yan. Thank you.
So dun tayo sa may body temperature. Okay, so dito na tayo sa may body temperature. Pinag-uusapan natin about body temperature, right? Ano ba ito? Nilalagay ko dito. Okay. So, sa body temperature natin, sabi ko kanina, yung normal temperature ranges from 98.6 degrees Fahrenheit. So, ito yung according to the American Academy of Family Physicians. Hypothermia is defined as a drop in the body temperature below 95 degrees. So ito, usually, nakita nyo kanina dun sa first nating slide, yung mga equipments natin na gagamitin natin. So as in the photo, ito yung ginagamit nating mga thermometers now, digital thermometers. Kasi tinanggal na natin yung olden days, yung previous na ginagamit, yung may mercury. Kaya tatandaan ninyo, wala na tayong mercury ngayon. So, na-shift na lahat ito, na-change na ng mga digitals. Okay, so yung left is yung thermometer na digital and yung scanner na tinatawag or the forehead for the skin. So, the ways of taking body temperature, meron tayong ways ng body temperature natin na dapat nating i-take. Number 1, yung oral temperature, it is taken orally by mouth. Oral temperature. Temperature can be taken by mouth using the more modern digital thermometers that use an electronic probe to measure body temperature. So, i-define pa natin, explain pa natin more when we come into the later slide. Ito pa lang dinidiscuss ko yung ano ba yung mga how-to ways, the ways of taking body temperature. Second is rectally, birectal. Yung temperature nito, birectum. So we are calling it rectal temperature. So this temperature taken rectally using a glass or digital thermometer tend to be 0.5 to 0.7 degrees Fahrenheit higher than when taken by mouth. So makikita natin dito, hindi lahat pag kinuha mo yung oral temperature, the same ang reading sa rectal. So ang rectal is higher ng 0.5 dun sa oral. Axillary temperature is taken under the arm, sa kilikili ito. So temperatures can be taken under the arm using a glass or digital thermometer. And temperatures taken by this route tend to be 0.3 to 0.4 degrees Fahrenheit lower than those temperature taken by mouth. So, yung axillary ngayon, so 0.3, 0.4 lower than the mouth din. So, yung oral natin, yung rectal natin naman is higher ng 1, ng 0.5 to 0.7. So talagang may variation, hindi siya pare-pareho. Tympanic temperature is taken by ear, and a special thermometer can quickly measure the temperature of the eardrum, which reflects the body's core temperature. Yung pag sinabi niyang yung core temperature, included dun sa mga internal organ natin. So nadidetect niya yung init doon sa internal organs. So yung tympanic temperature by ear. By skin naman on the forehead over the temporal artery. So either na temporal artery siya or sa forehead lang itself, you can manage to take the temperature by skin. A special thermometer can quickly measure the temperature of the skin on the forehead. So yun yung ating mga temperatures to be taken doon sa mga part na yon. So what are the indications for this measurement? Why we need to take temperature? Number one is to obtain a baseline temperature to enable comparisons to be made with future recordings. Like for example, your patient are coming to the unit or to the clinic. So yung pasyente nyo is may high temperature. So yung succeeding ninyo na mga checkin na temperature, so yun yung first is the baseline. So pagka after 15 minutes, you have checked the temperature again, meron na siyang changes, means to say, meron siyang change from the baseline. So either it comes up higher or it went down lower than doon sa temperature nyo nakuha at the baseline. To enable close observation in resolving hypothermia or hyperthermia. So ito, another observation mo dito, pagka yung second na reading mo is higher or lower, mai-report mo na dun sa nurse o dun sa doctor na merong changes. Kung nag-hyperthermia, tumaas pa dun sa dating baseline, means to say ma-alarm ka. And so with dun sa hypothermia. Number 3 is to observe and monitor patients for changes indicating an infection. Sometimes or more often, the fever, especially for the hyperthermia, indicates yung infection sa katawan. So depende ngayon, ang doktor dumidepende doon sa inyo na nag-check kayo ng mga temperature, accurate temperature. Kasi basis ni doktor yung kukunin mong report. Number 4 is to monitor the effect of treatment for antimicrobial therapy for infection. So once the doctor has found out na tumataas yung temperature niya, it might be or most probably it is the result of yung kanyang hindi effective na antimicrobial therapy. So gagawin niya, either palitan niya ito or to add another test investigation, lab investigations to confirm na either yung fever is due to dun sa infection or dun sa antibiotic na hindi effective doon sa pasyente. Before and during a blood transfusion, to monitor for signs of reaction. So during kasi blood transfusion, nagbibigay ng dugo, nagsasali ng dugo. So kailangan nito every 15 minutes as a standard. So kailangan i-check natin every 15 minutes. Why? It is indicated whether there is a reaction. May reaction doon sa ating pasyente. So one reaction comes with high temperature. Pag naglagnat yung pasyente mo during the transfusion, it indicates na merong reaction. Okay, so those are the importance why we are taking body temperature. So now we go
Miss Ann, wala po kayong boses.
sa akin.
Meron sa akin.
Wala pong boses.
Baka sa kanya, ma'am.
Sa iyo
Meron
lang.
sa akin.
Wala pa, Maya? Sa inyo, Vilma, Mila, Emma,
Meron po sa amin,
kayo?
ma'am. Meron
po,
sa amin.
Meron po.
Okay. So, ibig sabihin, sa iyo lang siguro dyan. Lola, what
Si
about
Maya
you?
lang wala.
Okay. So, siya lang ang wala. Okay. So,
May
checkin
sabi
mo
sa
yung
kanya
signal
po
mo
na
dyan.
palitan yung headset niya po. Yung headset
sa
niya
atin?
hindi nag-work po.
Okay. Kasi ma'am, yung the rest meron eh.
Oo,
So, siya
tama.
lang
Yung
yun.
headset niya, ma'am,
Wala sa akin.
yung headset niya hindi nag-work.
Okay. So, okay ka na, Maya? You can hear now? Wala? Wala daw, ma'am eh.
Baka volume niya.
Baka yung headset mo. Yung headset mo.
Kinuha na niya yung headset niya.
Yung headset mo, check mo.
Baka yung ano niya.
Headset mo o yung signal.
Yeah, signal. Kakat sa atok kaya.
Okay, so we will continue. Maya, ano na nangyari sa'yo, Maya? Either change niya yung headset or she is not going to use that headset anymore.
Meron naglalaro. Dami.
Ano?
Hi, Dara.
Wala pa din daw.
Wala daw eh.
Sa signal yan, ma'am. Minsan kasi nangyayari yung ganun.
Yun na nga, oo. Sa signal yun. Baka mahina yung signal niya doon.
Opo.
Wala, hindi ko siya madidinig.
Naririnig kita.
Balik ko naman headset ko, ah.
Huwag ka nang mag-use ng headset kung hindi mo maririnig. Meron?
Baka signal niya talaga.
Oo, kasi only one. Siya lang naman eh. The rest kayo meron.
Kaya nga,
Okay na? So we will continue?
sige na po.
Okay. So, hanggang hindi na ayos yung headset mo, makinig ka na lang. Dito ka na lang tumingin dun sa ating slides para masusundan niya. So anyway, what are the methods for this measurement? So ano ba ang mga different methods used for measuring temperature? So yung mga methods na to, it produces different results. As I said, yung kaninang oral, yung kanina nating axilla to the rectal, iba-iba yung mga results ng reading. The temperature reading depends on which part of the body is being measured. Pero typically, daytime temperatures among healthy adults are as follows. Yung rectal and tympanic temperature is about 37.5, 99.5 degrees Fahrenheit. The oral temperature is about 36.8, which is 98.2 degrees Fahrenheit. And axillary temperature is about 36.5, 97.7 degrees Fahrenheit. So you can see, ito yung mga normal nila, nagva-variate. Meron siyang variation. Magkakaiba. So hindi ibig sabihin na dun sa rectal temperature which is 0.5 higher, may fever na kaagad. So i-base natin doon sa normal ng kinuha natin or the method that we used. So dito tayo ngayon. Sa mga procedures naman, number 1 natin is the oral method, yung taken by mouth. The temperature which is taken by mouth is orally. So the mouth method can be used for children who are older than 5 years of age. It is not recommended, so tandaan ninyo, it is not recommended for children younger than 5 years of age. Why? Because it is hard for them to hold the thermometer under child or adult's tongue. So usually, under the tongue long enough. Kung gusto mong matake yun, so ikaw hahawak. Hawakan mo siya, explain mo sa pasyente, dun sa mga 5 years old, explain nyo na hahawakan ko, maki-cooperate ka, wag kang gagalaw or something. So number 1 is how to do it. You carefully place the tip of the thermometer under the child or adult's tongue. So explain nyo sa pasyente, ilalagay ko to doon sa under nung iyong dila. Okay, just keep it for a while until marinig natin yung bleep. So second, when the mouth is closed, leave the thermometer in place for about a minute until you hear the beep. So usually yung mga digital thermometers natin may beeping sound. So hintayin natin yon, it denotes a 1 minute has passed. So remove the thermometer and read the temperature. So yung reading na nun, it will show doon sa maliit na open doon sa monitor na yon. So record the temperature result. Pag nag-record kayo, it should be accurate. Accurately record kung ano yung nakita nyo, kung ano yung reading, yun ang ire-record ninyo. Huwag nating huhulaan, okay? So number 2 is the tympanic method, which is taken by ear. So how to do it? The ear method is recommended for children older than 2 years old. Though quick to use, the ear method can produce temperature readings that are incorrect, even when the manufacturer's directions are followed. So medyo merong hindi maayos na measurement ang makukuha natin. So talagang andun pa rin tayo, babalik tayo sa oral. So use a clean probe tip each time and follow the manufacturer's instructions carefully. Gently tug on the ear, kailangang itaas mo ng konti, yung hilain mo ng konting pataas, pulling it back. This will help strengthen the ear canal and make a clear path inside the earlobe, inside the ear to the eardrum. So pagka kasi tinaas mo ng konti, ibig sabihin ma-stretch yun. So meron kang tendency na makapasok ng maayos yung iyong disposable na disposable na tip ng iyong thermometer. So gently insert the thermometer until the ear canal is fully sealed off. May mga nagtatanong, hindi daw ba masusundot yung eardrum? No. So kasi yung ating disposable na cover, hanggang dun lang siya. Hindi na siya papasukin pa dun sa gitna or dun sa inside. So meron siyang enough space, dun lang siya papasok. Dun lang siya enough dun sa nakapasok siya. So squeeze and hold down the button for 1 second. Then remove the thermometer and read the temperature. So mas madali siya, hindi na siya 1 minute. Okay? So 1 second yung sinasabi sa atin. Mabilis yung tympanic method. Axillary method is taken under the armpit. So the armpit method is usually used to check for fever in newborns and young children. So yung mga newborn natin, pwede natin silang i-take dito sa kilikili, o yung mga young children natin na kung minsan pasaway ay na kinakagat nila yung oral. So advisable sa kanila na ilagay nyo sa kilikili at i-advise nyo na lang na ipitin yon. So place the tip of the thermometer in the center of the armpit. So tuck your child's arm snugly, closely against their body. Leave the thermometer. Kung minsan, alam nyo, yung mga batang pasyente, pasaway nga kalalagay mo pa lang, alam mo yon, itataas niya yung kilikili niya. Babagsak yung thermometer. So, yun, maging alert kayo sa kanila kasi may mga pasaway na pasyente. So leave the thermometer in place for about a minute until you hear the beep. Remove the thermometer and read the temperature. Rectal method is in the rectum. So the rectal method can be used to check for fevers in newborns and young children. So use a rectal thermometer only if you are comfortable doing so and if a healthcare provider has shown you how to do it safely. So papakita mo muna sa kanila, lalo na yung mga young children, o ito ilalagay natin. So lahat ng procedure natin, any procedure, give them a good explanation bago nyo gagawin. Cover the silver tip with petroleum jelly. Yung rectal natin, kailangan ginagamitan natin ng mga lubricants. Like yung petroleum jelly, yung Vaseline, yun ang mga nilalagay para sa easy insertion. So gently insert. You ask the mother kung nandyan yung nanay, na nandun yung baby niya sa lap niya, i-turn their back, tapos i-bend yung knees. Gently insert the thermometer in the rectum, about 2.5, 1 inch, holding it in place with your fingers. So kailangan mo ito, kailangang hahawakan mo. Okay, kung hindi, lalabas siya pagka pinasok mo, lalabas siya. Hindi siya magi-stay doon without holding it. So leave the thermometer in place for about a minute until you hear the beep. So remove the thermometer and read the temperature. So number 4, by skin on the forehead over temporal artery. So ito yung ginagamit natin mostly, nakikita nyo doon sa COVID natin na mga ginagamit for this pandemic, yung ating mga scanner. Meron tayong thermometer scanners ngayon or infrared. So they are using it, yun hindi mo na itatouch yung forehead. So i-scan na lang niya around 1 inch or 2 inches away, ma-scan mo na yung temperature. So using a temporal artery thermometer or yung thermometer scanner ang tawag doon. Turn the thermometer on, place the protective cap on the thermometer. So kung infrared lang yun o yung mga scanner, no need for the protective cap. So sweep the thermometer gently across the forehead so the infrared scanner can measure the temperature of the temporal artery. Record the temperature and the time. So kailangan pagka yung another patient, may 1, 2, 3 pasyente na kukunan kayo, so make it a habit na kailangan iwa-wipe yun or change yung disposable cup na cover. So talking about the pulse rate. So okay, the pulse rate is a measurement of the heart rate or the number of heartbeats per minute. Usually, pag sinabi nating pulse rate, coordinated siya with the same reading of the heartbeat. Okay? So pag kinuhanan nyo ng pulse rate, automatically, it's almost the same as the heart rate. So as the heart pushes blood through the arteries expand and contract with the flow of the blood. So the resting pulse rate for an average adult is between 60 and 80 beats per minute. But some other references, umaabot tayo ng 100. So 60 to 80 or to 100. So taking a pulse not only measures the heart rate, but it can also indicate the following. So yung heart rate, pagka chine-check natin, especially with the use of ating stethoscope, sa may heart, yung heart rhythm nito, regular ba siya o nag-i-skip-skip? So yung heart rhythm niya, so hindi lang yung heartbeat. Sabi niya rito, heart rhythm din ay na-check. So strength of the pulse naman, pag kinuhanan mo sa radial pulse, yung strength, malakas yung pagkabog ng kanyang pulse doon sa kamay. The pulse is a bulge of an artery from waves of blood that course through the blood vessels each time the heart beats. Hindi ba nakakaano yung nag-aaral tayo, pinag-aaralan natin? Hindi ba very parang mysterious? Kasi imaginein mo pala yung ah, tumata yung bulge ng artery dun sa kamay natin, yun din yung pagbulwak ng blood vessel mo na mag-push ng blood, yung heartbeat mo is considered as synchronizing. Yung naririnig mo yung dito sa pulse is the same thing kung gagamitin mo yung stethoscope to auscultate, the same thing yung heartbeat, ganun ang kanilang yung strength ng sound. So the pulse is often taken at the wrist to estimate the heart rate. Okay, so usually the most common na site where we are taking the pulse rate is in radial, dito sa may kamay, sa may kamay ngayon, di ba? Sa may kamay. So the normal pulse for healthy adults ranges from 60 to 100 beats per minute. So kanina sinabi ko sa inyo 60 to 80. Yung ibang references 60 to 100. So doon tayo pumunta sa 60 to 100 para kasama yung 80. The pulse rate may fluctuate and increase during exercises with the illness, injury, and emotion. So parang ito din yung body temperature. It's the same with the pulse. Pag may activity ka, naiiba. Lumalakas, humihina. Kung ikaw ay may sakit, lalo na sa may mga puso, the more mababa ang pulse rate o heartbeat. Yung may mga na-injured, nasaktan, so definitely, pag may masakit, mataas ang rate niya. Pag emotional ka naman, umiiyak ka, o meron sa inyong may problema, nada-down. So, nagba-variate din yun. May variation din siya. So, females ages 12 and older in general tend to have faster heart rates than do males. So, makikita natin na yung female pala, pagka mga 12 years old na and older, in general, mas mataas ang sa babae. So the athletes such as runners who do a lot of cardiovascular conditioning may have heart rate near 40 beats. Imagine niyo mababa ito. But you are not being alarmed kasi healthy naman siya. It so happen yung the more na nag-exercise, especially for the cardiovascular conditioning, they have the heart rate of less. So may mga 40 yon beats per minute. And we should not be alarmed, walang problema yon. So pulse rate, ano ba ang difference natin sa pulse rate at saka sa heart rate? So the heart rate is the number of times the heart beats in the space of a minute. Sa 1 minute, ito yung beat, ang pagbilang natin doon is lab-dab 1, lab-dab 2, ganun. May naririnig tayong ganung sound when we take yung ating heart rate through yung gamit nating stethoscope. Hindi natin ito maririnig without the help of stethoscope. Okay? So, means to say, pag narinig nyo yung lab-dab, 1 lang yun ha. Kada lab-dab is 1. Okay? So the pulse rate is exactly equal to the heartbeat. So equal sila. As the contractions of the heart cause the increases in blood pressure in the arteries that lead to a noticeable pulse. So yung pagbeat niya, pag-contract ng heart na nag-i-increase yung blood flow, may pressure, it leads to mabilis na tambok ng pulso. Okay, so our conclusion now, taking the pulse is therefore a direct measure of heart rate. So pareho equal sila. Pag sinabi ng doktor, take the patient's pulse rate, automatically yon, either you taken the heart rate and the pulse rate, it will be the same reading. So going forward, dito naman tayo, dito naman tayo sa mga pulse points location. So we must identify where we can palpate ang ating mga pulses. So there are around 9 sites, points, 9 points where we can locate yung ating pulse rate. Kung saan tayo po pwedeng mag-check ng pulse rate ng pasyente. So itong pinag-uusapan natin ngayon, since wala pa tayong yung ating actual demonstration about this one, i-imagine ninyo, gawin nyo sa sarili ninyo, and then you will find out na ito pala yung mga pulses. Okay? You just follow me kung ano ito, masusundan nyo. So it will be easy for you when we come into an actual demonstration. Nasubukan ko na to. And you keep on practicing kung nasaan ito. So number 1, the pulse point is at the neck. Carotid artery ang tawag doon. So ipapalpate natin para makuha natin yung pulse rate through the neck. Dito sa ating neck, carotid artery ang tawag. Carotid pulse rate. So brachial artery dito sa may likod ng elbow. Ano ba tong tawag dito? Sa ibabaw ng elbow. Okay? So yun yung brachial artery. Ito ginagamit itong pulso na to pag kumukuha ng blood pressure. Radial artery at the wrist, ito yung most common. Lahat ng tao, lahat ng kahit na sinong healthcare professionals, common ang radial artery, yun kinukuhanan ng pulse rate. So femoral artery is at the groin. Doon sa singit natin, may artery doon, merong pulse rate. Popliteal artery behind the knee. Yung alak-alakan, may pulse rate din doon. Posterior tibial near the ankle joint, meron din siyang pulse rate. And the dorsalis pedis artery on the posterior of your foot, meron din siyang artery doon. May pulse rate din. Temporal artery, pag sumasakit yung ulo nyo, napipil nyo, may kumakabog-kabog dito. That is the temporal pulse. Okay? So yung apical artery, it's only taken through by the auscultation of the doctor or the healthcare professional with the use of stethoscope. Yun sa pinaka-base noong heart. So yung apical artery, you will find it, yung heartbeat sa may heart. So these are the pulse sites na pinag-uusapan natin. So yung temporal, dun sa ibabaw ng sa ulo natin, dun sa mga sides na may, kung may headache kayo na sinasabi ko, so ito yung temporal pulse. So yung going down, meron tayong carotid na artery. You can take the pulse dito sa may, between dito sa inyong jaws, at saka dito sa may mouth dito, at saka dito sa neck. Okay? Yung ating apical is on the base of the heart. Yung ginagamitan na stethoscope, so doon mo ito itatama doon sa point ng apical, sa baba. Yung ating ulnar, usually hindi naman to ginagamit. So yung ginagamit natin is to the left, yung brachial, yun doon sa ibabaw ng siko. So ito yung brachial na tinatawag. Whenever you take your blood pressure, doon nyo itututok yung stethoscope. So yung ating radial, the most common is the radial dito sa ating kamay. Popliteal, doon sa may tuhod natin, sa likod nun, yung alak-alakan, meron doon. Yung ating posterior tibial, doon sa lateral side ng ating foot, doon yun. And yung ating dorsalis pedis, yung sa ibabaw ng ating mga paa. Okay, so how to measure? Paano nating i-measure itong mga ito? So measuring pulse rate. So yung carotid artery natin, the common carotid artery is palpated on the neck below the jaw and lateral to the larynx or trachea. Midpoint siya between your earlobe at saka chin. Dito siya. Okay? So using the middle and index finger. Ang pagkuha natin ng pulse, ginagamitan parati ng index finger at saka ng ng middle finger and the index finger. So itong dalawa lang nito ang gagamitin ninyo na pagkuha ng mga pulse. Okay? So you can feel yung carotid ninyo, napipil nyo yon. Lagay nyo lang doon yung middle and the index finger. Put it in your dito sa carotid and you will feel saang pulse, saang point, saang site yung carotid artery. Brachial artery is palpated on the anterior aspect ng elbow by gently pressing the same, yung middle and index finger, using the middle and index finger. So, lagay nyo yun doon sa brachial nyo dito sa may ibabaw ng siko. So, ito yung brachial artery ninyo. So, commonly used to measure blood pressure with stethoscope and sphygmomanometer or yung kung ano man yung aneroid nyo. Radial artery pulse is palpated immediately above the wrist joint. Ito yung nasa kamay, near the base of the thumb. It is the most common site. Pag tinanong ko kayo or tinanong ko sa mga quizzes nyo, anin ang most common site of the pulse when you are taking the pulse rate? It is the radial artery pulse. Okay, so anatomically stop box alternative side by gently pressing the radial artery against the underlying bone with the middle and the index finger. So lahat is with the middle and index finger. Tatandaan nyo yan. Middle and index for taking the pulse rate. Pagka brachial, it is only used for taking blood pressure with the aid of the stethoscope. Femoral pulse, the femoral is palpated over the ventral high between the pubic symphysis and the anterior superior iliac spine with the middle and index finger. So lahat ito ginagamitan ng middle and index finger. Popliteal pulse is palpated on the posterior knee, yung sa alak-alakan with the middle and index finger. This pulse is more difficult to palpate as compared with the other pulses. So pag tinanong ko kayo what is the most difficult part at where you are going to take the pulse rate, it's the popliteal pulse. Posterior tibial pulse, the posterior pulse is palpated posterior and inferior of medial malleolus by gently pressing your medial artery against the underlying bone with the middle and index finger. Nasaan yung posterior tibial pulse? So it is dito sa may paa natin sa posterior sa ibabaw. Dorsalis pedis pulse is palpated in the groove between the first and second toes. Is slightly medial on the dorsum of the foot. So ito nasa distal and the middle with the middle with the use of middle and index fingers. So nandito ito, dorsalis pedis na tinatawag, andun siya sa between first and second toes. Temporal pulse is palpated on the temple. Ito yung ating sinasabi ko when you have the headache. So directly in front of the ear, so by the use of the middle and the index. Apical pulse is unilateral apical pulse or the apex of the heart. Can be located in the fifth intercostal space immediately to the left of the sternum by the use of stethoscope. So hindi nyo ma-check yung pulse ng apical if you are just using your two fingers. Kailangan with the aid of yung inyong stethoscope. So kailangan marunong tayong gumamit ng stethoscope, okay? So gagamitin natin yung stethoscope when we are already in our actual demonstration, in actual learning.